Everyone, welcome to our channel supporting video. In this video we are going to discuss about the laboratory diagnosis of the diabetes mellitus. And as we know that in previous video we explained about the diabetes mellitus and its causes. In this video we are going to classify the diabetes mellitus and laboratory diagnosis of it. So let's start the video. Initially, diabetes mellitus is of mainly two types. That is type 1 and type 2 mainly, but further it is classified into gestational diabetes and drug induced diabetes. So type 1 diabetes is the diabetes in which there is, as we discussed about that in the previous video, that insulin is secreted from the beta cell of the pancreas, and when there is autoimmune destruction of the beta cell, then there is decrease in the cell number of beta cell, which leads to the decreased synthesis of insulin, which is autoimmune. And type 2 diabetes mellitus. Type 2 diabetes mellitus is the types of the diabetes mellitus in which there is either a decrease in synthesis of the insulin or decreased sensitivity of the insulin, which mainly occur in obese patient. Further, gestational diabetes is the diabetes in which there is increase in the blood glucose level in the pregnant woman during the second or third trimester of the pregnancy. And drug induced diabetes, second or third trimester. And drug induced diabetes is due to any drug that either destroy beta cell or indirect effect. So now laboratory diagnosis of diabetes mellitus. In the laboratory diagnosis of the diabetes mellitus, we describe about different process of lab diagnosis. There are mainly or routinely used diagnosis are fasting blood glucose level. It means that individual should not have taken food for at least 8 hours. That is called fasting blood glucose level, and which is measured during early morning 9 a.m. after whole night starvation. Second, random blood glucose level. It is randomly blood glucose is measured. blood glucose is measured. In fasting blood glucose level for individual to be in the suffering from diabetes mellitus, the blood glucose value should be greater than 126 mg per deciliter, and if the value is within 100 to 126 mg per deciliter, then it is pre-diabetes condition. Pre-diabetic condition. Pre-diabetic condition means the condition in which there is increase in the blood glucose level, but the individual is not suffering from diabetes mellitus, but neither considered to be normal. And in the random blood glucose level, if the blood glucose level is greater than 200 mg per deciliter, then individual can be considered as diabetic mellitus. For pre-diabetic condition in this case, the blood glucose levels will be 140 to 199 mg per deciliter. Other method are, that is modern method, that is glycated hemoglobin, measuring the glycated hemoglobin, which indicates the blood glucose level prior to 2 to 3 months of suffering from diabetes mellitus. It indicates that chronic complication of diabetes mellitus like microvascular complication like retinopathy, nephropathy and neuropathy. In this, for the patient should be to be in the diabetes mellitus condition, the glycated hemoglobin, which is indicated by HbA1c, should be greater than 6.4%, and the normal value is 5.7% to 6.4%. These are the maximally used diagnosis of the diabetes mellitus. And other are the autoantibodies against the beta cells, which can also be diagnosed in diabetes mellitus patient. And that is in random blood glucose level, there is one test called oral glucose tolerance test. Oral glucose tolerance test. In this, 75 gram of anhydrous blood glucose is taken in water and given to the patient to drink, and after 2 hours the blood glucose level is measured, and if the blood glucose level is greater than 200 mg per deciliter, then patient is suffering from diabetes mellitus. In this way we can diagnose the diabetes mellitus condition of the patient, if the patient is suffering from diabetes mellitus or he or she is in pre-diabetic condition. Thank you so much. And finally, if this video is helpful to you, then please like and subscribe our channel. Thank you.